my name is Malia Parker. I'm a student physical therapist assistant at Jeff State. Today, you will be learning about Pseudomonas aeruginosa, commonly called Pseudomonas. What is Pseudomonas? Pseudomonas is a bacteria that can cause infection. It is opportunistic, meaning that it infects people who have a compromised immune system. It is one of the most common nosocomial infections, meaning that it is hospital-acquired or skilled nursing facility acquired. Its multi-drug resistance is increasing, which is due to the misuse of antibiotics. Populations at risk for Pseudomonas are premature infants, aging adults, also individuals with debilitating disease, wounds, burns, urinary catheters, cystic fibrosis, chronic lung disease, neutropenia, and diabetes. And neutropenia is the abnormal low level of neutrophils, which is a white blood cell. And white blood cells help to fight infection, and this is commonly associated with chemotherapy. A reservoir is an environment in which an organism can live and multiply. Some reservoirs that Pseudomonas lives in is swimming pools, whirlpool tubs, respiratory therapy equipment, flowers, endoscopes, and cleaning solutions. Pathology. Pseudomonas produces proteins that allow it to bind to tissue. It invades and destroys tissue. Damage to the tissue causes surface molecules to be uncovered, which are binding sites for this bacteria. Produces proteoglycans that surround and protect it. It releases extracellular enzymes that are part of tissue invasion and necrotizing lesions. Pseudomonas attacks small arteries and veins, which leads to vascular thrombosis and hemorrhagic necrosis. Invasion of blood vessels can lead to bacteremia, which is bacteria within the blood, dissemination, which is the infection spreading throughout the body, and sepsis, which is a severe response to the infection. Pseudomonas causes infection of the respiratory tract, bloodstream, central nervous system, skin, soft tissues, bones and joints, and other parts of the body. And here we have a picture of the brain and spinal cord, which make up the central nervous system. Pneumonia. Pseudomonas is one of the most common causes of nosocomial infection. Signs and symptoms of pneumonia: shortness of breath, fever, productive cough, low oxygenation, elevated white cell count, and delirium. Skin breakdown. One example of skin breakdown is pressure ulcers. And so we see right here, we have someone with some type of wound. It's not exactly a pressure ulcer, but with some wound that is infected with Pseudomonas, and you can see the blue-green color because it produces blue-green exudate within the wound, and that wound would have a fruity odor. And you can see where they clean the wound out, and you can see the clean wound on the end. Burns. Usually Pseudomonas infects third-degree burns, and it creates a multifocal black or dark brown discoloration of eschar. And we can see in this burn right here the different colors that are associated with a Pseudomonas infection of third-degree burns. Other Pseudomonas infections. We learned earlier that Pseudomonas can spread throughout the body and infect many different things. Here we have a picture of a cornea that is infected with Pseudomonas. It creates corneal ulcers, can lead to vision loss. Another Pseudomonas infection is of the ear. And here we have benign, which is swimmer's ear. We have the young lady holding her ear, because we all know how painful swimmer's ear is. And malignant, which would infect the bones and tissues of the ear. The spread of the Pseudomonas organism is by contact. So this is why it is important to adhere to all the contact precautions that we see. Spread of infection. Healthcare workers have been known to spread this organism on their hands or under fingernails. And here we have a picture of Pseudomonas under someone's fingernail, and you can see the green color up under it. Diagnosis. To diagnose Pseudomonas, it requires isolation of the organism in blood, spinal fluid, urine, exudate, or sputum culture. Sputum is a thick liquid produced by the lungs, and it lies within the lungs and the pathways to the lungs. And exudate is a fluid emitted by an organism through pores or a wound. Prognosis. With a local infection, this infection is usually treated without complications. And here we have a picture of someone with a small local infection in a wound. Or if it's septicemic, it is associated with a high mortality rate. Treatment of Pseudomonas may include antibiotics, surgery, pulmonary therapy, respiratory assistance, or other supportive measures. When we are looking at the Nagy model, we have the first example we're going to talk about is a wound. The impairment would be decreased range of motion. The functional limitation would be a gait dysfunction. The disability could be the inability to walk to the kitchen and complete ADLs. If we're looking at an eye, as we've seen earlier with the corneal ulcer, the impairment would actually be the corneal ulcer. The functional limitation would be decreased balance. The disability would be loss of vision. All right, implications for physical therapy. If we have a wound, as we saw earlier, that is infected with Pseudomonas, we could use E-stim. As we see here, we probably have a high volt pulse current with the negative over the infected portion of the wound to help decrease the infection or rid the wound of the infection. And then with the eye, since the loss of balance due to loss of vision, we could address the balance issues with exercises. As we learned earlier, Pseudomonas is one of the most common causes of nosocomial pneumonia infection. And with that pneumonia, it causes low oxygenation and elevated white cell count. So it is important to watch the lab values so they do not get in ranges that are contraindications for therapy. Prevention. Washing your hands is the easiest and most effective preventive measure of spreading this organism. You should still wash your hands before and after, even if wearing gloves. So we see that we can carry the infection even on the devices that we use or under our fingernails or on our hands. And so that's why it's important for us to wash our hands. It wouldn't necessarily infect us because we do not have a weak immune system like most of the people in the hospital. So if we spread it to them and it affects them and it infects their whole body, then it's because of us. And so we can prevent that by washing our hands and making sure that we keep our equipment clean and things like that. But that's all. So thank you for listening today. And if you have any questions, just ask me on the discussion board. Thank you.